General anesthesia is a combination of medications that put you in a sleep-like state before a surgery or other medical procedure. Under general anesthesia, you don't feel pain because you're completely unconscious. General anesthesia usually uses a combination of intravenous drugs and inhaled gases, anesthetics. General anesthesia is more than just being asleep, though it will likely feel that way to you. But the anesthetized brain doesn't respond to pain signals or reflexes. An anesthesiologist is a specially trained doctor who specializes in anesthesia. While you're under anesthesia, the anesthesiologist monitors your body's vital functions and manages your breathing. In many hospitals, an anesthesiologist and a certified registered nurse anesthetist (CRNA) work together during your procedure. Your anesthesiologist or nurse anesthetist, along with your doctor, will recommend the best anesthesia option for you based on the type of surgery you are having, your overall health, and your individual preferences. For certain procedures, your team may recommend general anesthesia. These include procedures that may take a long time, result in significant blood loss, expose you to a cold environment, affect your breathing, particularly chest or upper abdominal, surgery. Other forms of anesthesia, such as light sedation combined with local anesthesia for a small area, or regional anesthesia for a larger part of your body, may not be appropriate for more involved procedures. General anesthesia is overall very safe. Most people, even those with significant health conditions, are able to undergo general anesthesia itself without serious problems. Older adults, or those with serious medical problems, particularly those undergoing more extensive procedures, may be at increased risk of postoperative confusion, pneumonia, or even stroke and heart attack. Specific conditions that can increase your risk of complications during surgery include smoking. Estimates vary, but about 1 or 2 people in every 1,000 may be partially awake during general anesthesia and experience what is called unintended intraoperative awareness. It is even rarer to experience pain, but this can occur as well. Because of the muscle relaxants given before surgery, people are unable to move or speak to let doctors know that they are awake or experiencing pain. For some patients, this may cause long-term psychological problems, similar to. Always follow your doctor's instructions about avoiding food and drink before surgery. You to take some of your regular medications with a small sip of water during your fasting time. You may need to avoid some medications, such as aspirin and some other over-the-counter blood thinners, for at least a week before your procedure. Discuss the types of dietary supplements you take with your doctor before your surgery. Before you undergo general anesthesia, your anesthesiologist will talk with you and may ask questions about your health history, your prescription medications, over-the-counter medications, and herbal supplements, allergies, your past experiences with anesthesia. This will help your anesthesiologist choose the medications that will be the safest for you. Once you're asleep, the anesthesiologist may insert a tube into your mouth and down your windpipe. The tube ensures that you get enough oxygen and protects your lungs from blood or other fluids, such as stomach fluids. Muscle relaxants before doctors insert the tube to relax the muscles in your windpipe. Your doctor may use other options, such as a laryngeal airway mask, to help manage your breathing during surgery. When the surgery is complete, the anesthesiologist reverses the medications to wake you up. You'll slowly wake either in the operating room or the recovery room. You'll probably feel groggy and a little confused when you first wake. You may experience common side effects such as nausea, vomiting, dry mouth, sore throat, muscle aches, itching, shivering, sleepiness, mild hoarseness. You may also experience other side effects after you awaken from anesthesia, such as pain. Your anesthesia care team will ask you about your pain and other side effects. Side effects depend on your individual condition and the type of surgery. Your doctor may give you medications after your procedure to reduce pain and nausea. Thank you for watching this video. Hit the subscribe button so you can get new videos. You can read more about this on our website www.wellnessbuddy.com.